to the webinar for Sutton parents, guardians and carers about the COVID-19 vaccination programme relating to 12 to 15-year-olds. I'm Dino Pardinani. I'm GP Clinical Chair of Sutton Borough, South West London CCG, NHS Place Leader. On the next slide, you'll see I'm going to be joined today by an expert panel, which includes Dr. Michael Pambos, who's a Joint Clinical Director of Central Sutton Primary Care Network, and also the Accountable Officer for the COVID vaccination programme for Sutton. I'll also be joined by Carol Selvey, who's the Joint Vice Chair of Sutton Borough, South West London CCG. Dr. Imran Chowdhury, Strategic Director of Public Health for London Borough of Sutton. Sarah Taylor, Chief Pharmacist for Sutton Borough. Nicola Kane, Interim Director of Nursing for Hounslow and Richmond Community Healthcare NHS Trust and Chief Nurse for Kingston Hospital. And Una Dalton, Programme Director for the COVID-19 and flu vaccinations for South West London CCG. On the next slides, you'll see that the aim of today's session is very much to support our parents, carers and local communities around understanding the COVID-19 vaccination programme for children aged between 12 and 15 years old. There'll be ample opportunity to ask questions. So following this introduction, I'll soon introduce the Interim Director of Nursing, Community Nursing, to talk a bit more about the vaccine and then about the school immunisation programme and consent process. Following that, the Chief Pharmacist will talk a bit about vaccine and safety, and then just before 7 o'clock we'll close the presentations and then open up the floor to questions and answers. We're aiming to finish the event by 7:30, so that gives us a good hour on the topic. In terms of a bit of housekeeping just before we start, just on the housekeeping slide, in terms of how this meet operates, it's a live Teams event, so only the webinar chair, so myself and the panelists, will be visible on the camera. The attendees will not be able to turn on the cameras, but questions can be asked by the chat function. So please, as soon as you have a question that comes to hand, put that in the chat box, and we'll answer as many of the questions as we can live this evening. Any questions we can't get to, we'll make sure that we take them away and they're followed up, and we'll get the answers back to you following the event. Okay, so I'm going to move on then to the first presentation. I'm going to introduce Nicola Kane, who's going to talk a bit more about the vaccine and then the school immunisation programme and consent process. Thank you, Nicola.
Thank you. Next slide, please. Brilliant, thank you. So the Chief Medical Officer has recommended that 12 to 15-year-olds receive their first dose of the COVID-19 vaccine. The ultimate aim of vaccinating 12 to 15-year-olds is to reduce outbreaks within schools, but also to protect the vulnerable, friends and family. So across South West London, we've started to undertake the vaccination programme, and that we are rolling this programme out within schools. And many of you will actually have received a letter from me inviting your younger person to be vaccinated within schools. In addition to the school vaccination programme, some of you will have also seen that we have got some alternative provisions local to you, which will enable your 12 to 15-year-old to access the COVID-19 vaccine. And again, we are looking at exploring alternative options for children or younger people who are homeschooled or are cared for within a specialist provision. Thank you. Next slide, please. So we're running this programme in over 200 schools across South West London, and what we're asking for is parental consent. And as I say, you should have received a letter now, because we have booked all schools in South West London a date for vaccination. So you should have had a letter from me, which has got some information around the vaccine and some frequently asked questions, and also an online consent form. And we're asking you to complete the consent form within 48 hours of us attending the school. And the reason for that kind of deadline is to enable us to make sure that we take the right amount of vaccine into the school, so that we're able to vaccinate your younger person. We've been running a really successful programme to date, which I'm really pleased of, and we've vaccinated over 4,000 children. So we're sitting about with a vaccination rate of about 34%, which is actually really good. As I mentioned earlier, there are some alternative solutions which are local to you. So you can, as an alternative, access the vaccine at the St Nicholas Centre through a walk-in process, or you can call 119, or you can book looking at the nhs.uk/COVID-vaccination website. Next slide, please. So as I've touched on, so we're looking for online consent to be completed in advance of us attending the school. But we really hope that this is actually a joint consent process between you and your younger person, so that your decision making is together, and that you're encouraging some rich discussion between yourself and your younger person to enable them to feel, fully informed about the vaccination. There are some occasions, and we have had this, where we've attended a school and we haven't actually received the online consent form, and your younger person may express a desire to have the vaccine. And I just want to assure you, as the kind of lead nurse for the vaccination programme, that we will do everything we can to ensure your younger person gets vaccinated. So what we will do is we'll seek verbal consent, so we'll try to contact you to see if you can get that consent, which will enable us to vaccinate your younger person. Thank you. And the next slide, please. So I'll just hand over to my colleague, Sarah Taylor, who will be able to give you some more information around the vaccine and the safety. Thank you.
Thank you. Next slide, please. So why is it important for 12 to 15-year-olds to get vaccinated? Well, when enough people get vaccinated, it's harder for a disease to spread to those who can't have vaccines. Getting vaccinated protects you from infection, and therefore if you aren't infected, it reduces the chance of you spreading it to your friends, family and your wider community, so it protects them too. It's also much safer for your immune system to learn to fight illnesses through vaccination than by catching the illness itself, potentially being very unwell as a result, and maybe even needing treatment and hospitalisation. Research has shown that the vaccines help reduce your risk of getting seriously ill or dying from COVID-19. They reduce your risk of catching or spreading COVID-19 and protect you against COVID-19 variants. Young people are at risk of these also, and so they're also at risk of developing long COVID. So it's just as important for them to have the protection from a vaccine. There is still a chance you might get or spread COVID-19 even if you have a vaccine. So it's still important that everybody follows the advice about how to avoid catching and spreading COVID-19. So the advice about regular hand washing, wearing face masks if you're able to, keeping your distance and self-isolating if you actually are infected are still really important. Next slide, please. So is it safe for children to have the COVID-19 vaccine, and what are the side effects? Well, now, nearly a year on, millions of people across the world have had the COVID vaccination. And as the vaccine has been used more and more, we've gained vital information about its safety. We now have a wealth of information, far more than when it was given first last year. What we do know for sure is that all of the vaccines that are used today in the UK have gone through very strict and rigorous tests to check that they're safe and that they're effective. And that's been done by our independent regulator, the MHRA here in the UK, but also similar tests and scrutiny looked at by other regulatory authorities across the world. The research and the data shows that the most common adverse effects following vaccination in children aged 12 to 17 are injection site pain, fever, sometimes headache, very similar to those that are seen in adults and similar to those that they would have had for other vaccinations when they were younger. All of these reactions are generally very mild and self-limiting and don't last very long, typically 1 or 2 days. There have been some very, very rare reports of a condition called myocarditis. Now that's an inflammation of the heart muscle, or of pericarditis, which is an inflammation of the membrane around the heart. As I say, this has been very, very rare, and where it has been reported, it's been reversible, and it certainly hasn't left the young person with any long-lasting effects. Next slide, please.
Thank you very much, both of you. Now, we're running slightly ahead of schedule, which is excellent news. We've had 2 extremely informative presentations there on the safety of the vaccine, as well as about the process for vaccination. Now we're very keen to take questions from the floor, and as I said before, these can be posted into the chat function, and we'll be grouping those together as they come in. For this section, I'm going to be assisted by Michelle Rahman, who's the Deputy Locality Director for Sutton Borough, South West London CCG, and we'll be looking to collate questions and then into themes, and then ask our expert panel to come back with answers. Just looking so far at the questions that have come in. Michelle, do you have many questions in the chat?
I saw a question there that I can't see any longer, so I'm going to root that out. But whilst we're looking for that, what I'll do is ask a question that has been frequently asked elsewhere. How did the COVID-19 vaccine get approved after such a short period of testing?
Okay, so this is about the process of approval for the COVID-19 vaccination after the period of testing. So this is a safety question. Sarah, would you like to maybe come in and offer an answer?
Yeah, absolutely. I think what's important to understand in the development of the COVID vaccine, that this has been developed following huge worldwide collaboration. Normally, a drug company will sit in isolation and develop a medicine by themselves. They will do the research, they will undertake the clinical trials, and then maybe progress on to further studies, and then they'll make the submission to the regulatory authority for approval to launch it to market. On this occasion, what's happened is, because of the drive to develop the vaccine, that's all happened in collaboration. The researchers have all shared their information with all of the pharmaceutical companies to really enable this to move at pace. And interestingly, the clinical trials have happened in parallel rather than in sequence. So as a result, we've really been able to compress the timeline and have it developed really very, very quickly. The testing, the studies have all been exactly the same standard, undergone exactly the same scrutiny. It's just been that it's been able to happen much more quickly because of the collaborative approach.
Thank you, Sarah. That's very comprehensive. I can see a few more questions starting to come through. Michelle, are any themes there that we can pick up?
Yes, there's a question here. Will a second dose be scheduled at the time of the first dose to all children?
Okay, so that's about the scheduling of the vaccine, and maybe I will come to Nicola on that question.
Thank you. So at the moment, the ask is for us to give one dose to the 12 to 15-year-old age group to try and vaccinate as many of within this age group as possible. However, we are offering 2 doses to children who are clinically vulnerable or do live with somebody who's clinically vulnerable. But if the child or the younger person sits outside that group, then is currently 1 dose at the moment.
Okay, thank you. That's really helpful.
How safe is it for autistic kids to be vaccinated? I heard that these children have higher chances of aneurysms, etc., due to brain wiring.
Okay, so I mean, there's a clinical question there. We obviously have a few clinicians and part of our expert panel, as well as safety questions sort of more generally from Sarah. Shall I come to one of the clinicians and then maybe some others can pick up this if need be. Michael, are you able to start off?
Yeah, thanks, Dina. So really very safe would be the short answer. So there's no increased risk of things like brain aneurysms because of the COVID vaccination. Equally, for children who are autistic, it's extremely safe to have a COVID vaccine. They are certainly more at risk of catching COVID and the terrible sort of after effects of having COVID. So we really encourage these children to be vaccinated. They'll also be eligible for 2 doses of the COVID boost, the COVID vaccine, as they are at higher risk of the after effects of if they were to catch COVID. There is no sort of increased risk of aneurysms, and that's not been seen across the world. So I think the reassuring thing is it's extremely safe for the children to have the vaccine.
Thank you, Michael. And obviously, we've seen millions of doses of vaccine rolled out globally, haven't we? Now, so we've got quite a good bank of evidence. Michelle, I'll come back to you.
So there was another safety question, but I believe that that's been covered by Michael's response, but also Sarah's response in terms of the myocarditis. So I'll move on to another question, which is why is it a single dose for this age group?
Okay, so in terms of the programme, Nicola, shall I come to you on this and then others if need be?
So at the moment, the principle is to try and get as many of this age group vaccinated as physically possible. So we're prioritising first doses, with the exception of those who are vulnerable or live with somebody vulnerable, just to maximise the number of younger people that we get vaccinated. There is nothing to say that that won't change into being advised around second doses, but just the principal ask at the moment from us is to ensure that we get 1 dose of the vaccine into this age group. And also, I mean, Sarah might want to talk about the effectiveness of 1 dose, which is one of the other drivers for the 1 dose.
Thank you, Nicola. That's helpful. Michelle, I think we've got a few more questions.
Yep, I shall go through them now. My daughter is 13 years old and has just had COVID. Does she need to wait any length of time before having the vaccination?
Okay, so sort of clinical question. That's a good question. Michael, are you able to take that?
Yeah, so the recommended time of wait is 28 days post-COVID vaccination, and that's the same whether it be for a child or an adult. Some people think, well, having a vaccine is still encouraged even if you have COVID. So although you do develop some natural immunity post-COVID infection, the length of that immunity is not as good and is not as strong as if you were to get the vaccine. So although you may have had COVID and that might give you a short-term slight protection, we always encourage, whether it be children or adults, to still go for their COVID vaccination, just to have that longer lasting protection, not only for themselves, but also for their loved ones. And certainly around Christmas time, when we're all mixing with sort of more frail, elderly loved ones in indoor spaces, that's really the best way of protecting our whole community and our whole family.
Thank you, Michael.
I'll move on to the next question. Where did the focus from the media on fertility issues come from? This is something which has raised concerns from my former partner, which has resulted in us not being aligned on giving consent, and therefore my child is not being vaccinated.
Okay. I'm wondering if I could maybe ask Una to come in first on this, and then if need be, I can hand over to one of the clinicians. Michael, certainly you'll probably also be able to answer this. Michael, do you want to actually maybe come in? I think Una's having a problem with the microphone, so maybe if you could answer that, Michael.
I think that a lot of sort of scaremongering has gone around on WhatsApp groups, on Facebook, about the fertility issue. And I think it was one of the most concerning, or the most anxiety-inducing question. And certainly when we were vaccinating adults fairly early on in the programme, it was a question that we had time and time again. And I'd like to sort of break it down into two ways of answering the question. So the science of getting a vaccine is that you get given a little bit of the bad bit of the virus shell. Your body learns how to attack it. So when you get confronted with the real deal, that your body quickly fights it off and you don't get the infection. So that's the science behind vaccination. So there's no physiological, genetic, mechanical way of that affecting your immune system, or sorry, of that affecting your fertility. The fertility is a completely different part of the body. It's the science behind it and the way your body works does not affect the germ cells, does not affect the ovaries, does not affect the testes, does not affect sperm or eggs. So the science of getting a vaccine does not affect fertility. So that's the science response to it. The other thing that we've done, because we've been vaccinating well, now millions of people across the globe, we can now have real life data and evidence of fertility rates of those vaccinated versus those unvaccinated, and there's no difference. So you're just as likely of unfortunately getting an unplanned pregnancy having had the vaccine as you are having not had the vaccine. Therefore, the conclusion is there is no differing fertility rate. So the vaccine does not affect fertility, whether you be sort of 12 or 112. Your fertility is still what it is, depending on your age group. So I think, and in particular teenage girls as well, very concerned about this. But all the data, all the evidence, all the real life studies, all the time that we've had with the vaccine has not proven any ill effects with vaccination and fertility.
Thanks, Michael, for going into some detail there about the evidence and the data that we have to date on the safety of the vaccine. Michelle, any further questions?
Yes, there are a fair few here. So why are so many people who have been vaccinated still getting COVID?
So obviously, why those who've been vaccinated, why could they still get COVID, and can they still get COVID? I mean, it's a clinical question. Michael, do you mind if I come back to you? I know you've just given a comprehensive answer there, but you're best placed.
It's something that you may look at that and think that the vaccine doesn't work, but actually the vaccine is, and certainly the Pfizer vaccine, we're talking about a 90% protection rate, which is very, very good. That's unbelievably good when you're talking about vaccines. But that's not 100%. Anything we do in life is never 100%. So you're always, you're never going to find the perfect vaccine which gives you 100% guarantee you're not going to catch COVID. So 90% is extremely good. So it's going to reduce your risk of catching it. Having had the vaccine, it also reduces your risk of getting symptomatic COVID, and also reduces your risk of ending up in hospital. So although you have the vaccine, you may catch COVID. Your chances are very small, 10%. But even if you were to catch it, then your chances of ending up in hospital are even smaller. So the vaccine has a twofold effect. One, protection from getting it, and two, protection from ending up in hospital, ending up on a ventilator, and ending up very unwell. The other reason why now some people are sort of in the adult population who've been double vaccinated, maybe having increasing rates of COVID, is unfortunately in the UK, our rates are really high, much higher than a lot of other places in Europe. So when you have a higher risk because COVID is circulating in high amounts, and you have a population who've been vaccinated well, but vaccination immunity is starting to dip, that's a mix of increased rates. That's why we encourage adults who've had both jabs and are eligible for a booster to also go for their booster. And that's why in the media you've seen it advertised, please go get your booster. It's just really to top up everyone's immunity. So when we have very high circulating rates of COVID, which we currently do, it's giving us the best protection we possibly can. So a vaccine is never 100% effective, but it's pretty darn good at 90% plus. It's going to reduce your risk of catching it, but reduce your risk of ending up in hospital. And ultimately, that's the main thing.
Yeah, thank you, Michael. Yeah, absolutely. Reducing the risk of severe complications is extremely important. Michelle.
So there are a number of questions that have already been answered that are around the safety aspects around fertility. They have been answered already, and also about the length of time between having COVID and then having the vaccination. So I'm going to pull up a question that's frequently asked, and it's, do we know the profile of individuals who are most likely to have side effects?
Okay, so profile of individuals who are most likely to have side effects. Can I come to Michael first, and then I'm happy sort of to maybe bring in others as well, because I don't want to. I want to make sure that we use our entire expertise across all of our panel. But Michael, I'll start with you, then maybe come to others.
So clinically, no, there doesn't appear to be any difference based on ethnicity, age, gender, weight, as to side effects from a vaccine. Most people will get what's called a vaccine immune response, which is very normal and very natural after a vaccination. You'll have a bit of a sore arm because we're physically putting a needle in the arm. You may have a low-grade temperature for a day or so. As your body starts getting used to this thing we've injected, your immune system starts generating the antibodies, which are the shield that protect you. You may feel a little bit sort of shivery for a day or so, but nothing that paracetamol or some ibuprofen won't treat. So that vaccine response is natural. It's actually a sign that your body is starting to make antibodies, and antibodies are the shield. Whether I can look at someone on the street and say, they're going to have more of a vaccine response, or they're going to feel a little bit more under the weather for a day or so, it's impossible to tell. And actually, there's no differing evidence between one person to the next. So that's from a clinical side, and from a pharmacist side, I think Sarah might, from your point of view.
Yeah, no, absolutely. As you said, Michael, the side effects that the adults and younger people experience tend to be about the same, and it's the side effects that you would expect to any vaccination. And again, as Michael said, they tend to be mild, fairly short-lived, and can be managed with something very simple like paracetamol that most people have at home anyway.
Thank you, both of you. I think the important point there as well is that there is no evidence of any particular people having a higher risk of side effects. I think that's important.
sorry to interrupt. There are some new questions in the chat.
Okay.
So if it's determined our kids need another second vaccine, do they need to have the Pfizer one for the second dose?
Okay, so in the case of a second vaccination, does it need to be Pfizer? So who would like to pick that one up? Shall I come to you, Nicola?
I'm going to defer to my colleague Sarah because she put her hand up first.
Oh, sorry, I didn't see your hand up, Sarah.
It's fine. I think at this stage it's too early to tell whether children would need a second dose, and therefore it's too early to tell what the second dose would be. But we would be looking to the JCVI and to the Chief Medical Officer for advice and guidance on that as and when that decision was made.
Yeah. And that decision would obviously be made based on the evidence, the available evidence, and the safety data. So, thank you for that, Sarah. Michelle, any more themes or questions?
How much does the vaccine protect against the Delta variant?
Okay, so obviously we know there are different variants of coronavirus. Specific question about Delta variant. Who would like to take that? Michael, do you want to start maybe?
Yeah, really quite well actually. So it's still you're looking at the high 80s, 90% protection. The thing with Delta is that it spreads like wildfire. It's really transmissible and will rip through communities and countries far greater than previous variants. And that, if we go back to all those meetings with Chris Whitty, where we would all tune in and we'd all be fixated about the R number, it has a much higher R number than previous variants, which is why it spreads so quickly. But the protection that the Pfizer vaccine gives against the Delta is really high, actually, sort of high 80s, 90s. So really good protection against Delta, as it will do against the previous variants and emerging variants as well. Sort of the Delta Plus, which is now on the scene as well.
Right, that's brilliant. That's really reassuring. Michelle, back to you.
Are there any precautions that need to be taken in respect of children with allergies?
Okay, so a question about allergies. Shall I come to you, Sarah, who's Chief Pharmacist on this?
Yeah, that's fine. Thank you. So there really aren't very many allergies that anybody has that would mean that they couldn't have the Pfizer vaccine. What I think is important is that as part of the screening and administration process, every single person is asked for a detailed history of any allergies that they may have. And that's allergies to food, to medicines, to environmental things like pollen, but also to any of the things that might be ingredients in the vaccine. At the vaccine sites, they have complete access to all of the ingredients in the vaccine, so they are able to check and see whether any of those items might be included. And if there's any doubt at all, the child won't be vaccinated. But there really are only really an allergy to one of the ingredients of the vaccine would mean that that child wouldn't be suitable for a vaccination.
Thank you, Sarah. And just to reassure, the question regarding whether your child has an allergy is a standard part of the pro forma questionnaire that all those being vaccinated are asked, so that will be asked and picked up. Michelle, back to you.
There's a question about the difference between the Pfizer and AstraZeneca. So what is the difference with the Pfizer and AstraZeneca? Do they work differently? And why was Pfizer chosen for this age group? Okay,
so the question now on the actual vaccine types, specifically Pfizer and AstraZeneca, and why Pfizer is being used for the 12 to 15-year-olds. So Sarah, I'll come back to you to start on this, if you may.
Yeah. Thanks, Dino. So yes, AstraZeneca and Pfizer are both two vaccines against the COVID-19 virus, rather, and they are slightly different. As Michael has already said, the Pfizer vaccine uses a small part of the virus messenger RNA in order to generate an immune response. The AstraZeneca is kind of like a weakened version of the virus, of the flu virus, but modified to be more similar to the COVID virus, which is injected. So that also will generate an immune response. So they generate your own body's immune response, but slightly differently. They are both just as effective once they're in use. I think to answer the why the Pfizer, there have been some concerns with the incidence of blood clots in younger people with the AstraZeneca vaccine. And so for that reason, the Pfizer vaccine is safer to use in this group of patients.
Thank you, Sarah. That's really helpful. And that's being used in other countries as well globally, isn't it? So there's a increasing body of evidence. Back to you, Michelle.
There's a policy type of question here. Who's responsible for the programme?
Okay, so who is actually responsible for the COVID vaccination programme? Una, shall I bring you in on this one?
Yeah, sure. The NHS is responsible for delivering this programme. We do so through HRCH, a commission to deliver on our behalf, but it is an NHS-led programme.
Thank you. Michelle?
I'm going back to a question about the drive for the vaccination. So why is there a drive to vaccinate children? Okay,
so why is there a drive to vaccinate children? I think obviously I think Michael did answer that before, but I think Michael, do you want to maybe just give a bit more so that we can hear that answer again?
I think we know that children are less likely to develop severe COVID. We've seen that for the last 2 years during the pandemic, but that's not to say that they won't develop severe COVID and that they are still just as risk of developing long COVID as well. So that, in terms of the children, that's why we're offering the vaccine, and that's why it's gone through the JVCI, and the Chief Medical Officer has recommended that children do get the vaccine to not only protect them now, where rates are really, really high, also to protect them for the future, as their immunity will last a long period of time, but also to prevent them, and finally, from long COVID. So if they were to catch COVID, the idea of the vaccine is to actually prevent them from catching COVID to any noticeable degree, or if they were to catch it, not to develop serious effects as well. That's the protection for the children. The other important thing that vaccination does for all of us is that we will protect each other. Me having a vaccine not only protects me, but it protects you. So children having a COVID vaccine protects them from COVID, but also protects their parents, protects their grandparents, protects their aunt and uncle. And when we are mixing more in closed environments, when we are sat around the Christmas table enjoying what we didn't enjoy last year, it's the best way of protecting our whole community by everyone getting the vaccine.
Thank you, Michael. That's really clear and comprehensive. Michelle, back to you.
So that there are a number of safety questions that have already been answered, but we've published them so that they can be seen, but they've been answered several times, so I won't ask those ones again. The question I'm moving on to is about the consent process. Now, I believe it may well have been answered previously, but just in case it wasn't heard clearly, how does the consent process work for 12 to 15-year-olds?
Okay, so a bit more about the consent. Obviously, Nicola's presentation did cover this, but Nicola, I'll come back to you if we can just explain that again.
Yeah, no problem. Within the letters that you receive from the school, there is an online consent form, And then we're asking parents to complete the online consent form, which, as Sarah mentioned, has got a list of questions around allergies. And there is also a frequently asked questions, but we're asking parents to consent using that method. The idea is that the consent is done in collaboration, so jointly with your younger person, so that they know that you've consented for them to receive the vaccine, and they too are comfortable receiving the vaccine. So where possible, we're encouraging a joint process. For those parents who perhaps have not completed the online form, there is an option if children or younger people express a desire to be vaccinated, that we can actually take consent from the younger person, and we will try and get verbal consent from the parents at the time that we're within the school.
Thank you, Nicola. That's very helpful. Michelle, back to you.
As this is a new vaccine, what do we know about possible long-term side effects, as this has been a significant worry amongst parents? Is this a reality?
Okay, so a safety concern question there about possible long-term side effects of vaccinations. Sarah, shall I start with you on this?
Thanks, Dino. So we've been using the vaccine now for over a year. Whilst that might not seem very long, it certainly has been given to millions and millions of patients, not just in the UK, but worldwide. As we've said, the side effects that have been reported have been those that are generally very mild and short-lived and easily managed at home. There haven't been significant numbers of reports of any long-term side effects from the vaccine.
Yeah. Thank you, Sarah. And I think the other thing is obviously the vaccine technologies themselves that are used to make these vaccines have been studied for a number of years and using other treatments which are very comparable without issue. So I think there's a lot of really evidence that they are very safe. Thank you. Michelle?
There's one more question here in the chat. Are we saying kids have longer immunity so they won't need the booster?
Okay, so this question is again relating to the single vaccine versus double vaccination, and the question is around whether that is because children have a longer length of immunity because of one vaccine, and therefore will they actually not require a second vaccine. So Nicola, shall I come to you on this, and then if either Sarah or Michael want to contribute as well, I'm happy to.
Well, I was going to be a bit naughty and defer actually to Michael on this one, if that's okay.
Or for Sarah, yeah.
Or Sarah.
Yeah, so in the UK, it's sort of a judgment call that the JVCI has made. We won't know until they reassess things probably in January, February, whether children would be offered the second vaccine. Other countries do it differently. America, Israel have been offering 2 jabs for their sort of 12 to 17 year olds. So it is variable country to country. So we have to go with the expertise of the JVCI, and on their call, it's at the moment that children who are healthy are only offered 1 vaccine. For those who are 12 to 17 who have underlying health conditions, they are currently and have always been offered in the UK 2 vaccines of the COVID vaccination. So there's just slightly differing views or different guidance at the moment.
Thank you, Michael. It's reassuring as well that the JCVI are operating a sort of a measured approach where they're looking at the available evidence and obviously the rollout of the vaccination programme to those ages where there's absolute unequivocal evidence of good safety effects, but at the same time looking at the data coming in globally. So it may be that, as you say, that things may evolve over the next few months on that. particular point. Michelle, thank you. Back to you on if there are any more questions.
There are no more questions. We've covered questions on the safety of the vaccine, side effects. We've covered pretty much all of the questions that are here. Yeah. Okay,
that's really good. I mean, we have got a little bit more time. As I said, we are scheduled to go up to 7:30, and I think there's been a really healthy group of questions already come through, and I think the panel have done an excellent job in fielding those. So we'll sort of leave the chat function open. If there are any more questions, please do ask. We are really keen to get as many 12 to 15-year-olds vaccinated as possible. It is, it's one of the best ways of us getting through this time that we're living in. And so any questions that might help to increase vaccination rates of 12 to 15-year-olds will be gladly taken, answered and responded to. And the other thing I think that we will do, we do have a number of questions on webinars and that have happened across South West London similar to this, and we've had other questions that have come in through there. And so what we'll do is we'll develop a sort of frequently answered question sheet and handout, and what we'll do, we'll post that on our dedicated Sutton COVID page, which will give the information and the details to all of those on the chat following this meeting. So Michelle, has there been, in that time I've been talking, has there been any further questions come in?
Yes, there is a question here. Can my child get the antibodies test instead? That's about the antibody testing.
Yeah. Okay, so there's a question about the antibody testing and whether having that test could be a substitute for the vaccination. So Michael, I'm going to come to you on this.
Yeah, so the short answer is no. So an antibody test just lets you know if you've had COVID at some point in the past, and actually studies have shown that those antibody tests very quickly become negative, even if you know you've had COVID. They're not a measure of your actual immunity. There isn't sort of a quantitative sort of value where it says, you're above this level, therefore your immunity is this. It's just a straight yes or no. Have you had COVID? Has your body developed some antibodies to it? The best way of protecting yourself in the long term and also in the short term is with a vaccine. It gives a much more effective antibody response, one that gives you a longer lasting, higher level of protection.
Yeah, that's really important message. Thank you for highlighting that. It was a good question, and very important to have that longer lasting effect to make sure you have the vaccine. Michelle, any other questions coming on the chat function?
Yes, so I know we've answered a question, or a few questions actually, on side effects, but I'm going to ask this one. What are the worrying side effects that may occur that we should look out for after vaccination?
Okay, so a question again about side effects, but particularly worrying side effects that one might think about after a vaccination. Sarah, I'll come to you on this one.
Okay, thank you. So I think, as we've said, most of the side effects are very mild, very short, limited, and in terms of time, and are easily treatable. There have been, as we said, very rare occurrences of myocarditis in some of these young people. Again, that has tended to be reasonably mild and has resolved after a short period of time. But I guess the symptoms of that myocarditis would be a shortness of breath, a chest pain which might spread, any difficulty in breathing, and maybe kind of like the feeling of an abnormal heart rhythm. And if you experienced any of those, whether it was related to the vaccine or not, you should be seeking medical help anyway.
Yeah, thank you, Sarah. Michael, do you want to add to that?
Yeah, and the other thing is after the vaccine, children will be monitored as well and observed for 15 minutes. So any short-term allergic type reactions will be picked up there and then. So they'll be in a period of monitoring as for adults having the vaccine as well. Just on the point of myocarditis, it's not just specific to vaccination. You can get myocarditis after a whole host of very common illnesses, even the common cold. Some children and adults can develop myocarditis, which is an inflammation of the heart muscle due to the common cold as an after effect of a virus. So it's nothing specific to vaccination that is causing this, but of course, if you do notice any worrying changes, make sure you speak to your GP, ask for help, and people will be there to guide you, reassure you, and examine if need be.
Thank you, Michael, and thank you for pointing out that post-infective myocarditis can occur after any infection, including COVID, so not related specifically to the vaccine at all. Michelle, back to you.
What happens if a child is asymptomatic and the lateral flow test is negative, but actually affected by COVID and has then had the vaccination at the same time? Will it cause a bad reaction? So this is about somebody who's asymptomatic, the lateral flow test is negative, but they then have COVID and have the vaccination at the same time.
Okay, so an asymptomatic patient had a lateral flow test, which is negative, and then co-administration of the vaccine, but presumably I'm assuming there were symptoms. Were there symptoms relating to the reason why they had the lateral flow test, or that's part of a routine test, perhaps?
It seems more like it was part of a routine test because they were asymptomatic. But they were actually affected by COVID, so they did get COVID, but then they had the vaccination. It's whether, that combination, would that cause a bad side effect? So having COVID and then having the COVID vaccination.
Yeah. So I think we sort of picked that up before, but well, I think, Michael, if I come back to you about the potential side effects of having the COVID vaccine following a COVID infection previously.
It shouldn't make the symptoms of COVID worse, as it were. So there are coincident, or you can't be 100% guaranteed in with the lateral flows or the PCRs and the timing of when you had it and when you have the vaccination. It won't make the COVID symptoms because you have COVID any worse. The theory of the 28-day window of why after a positive COVID infection, why we leave it 28 days is relatively historical, and it goes back to when we first started vaccinating with COVID. It was in that early phase to exclude any potential vaccine responses or side effects as a result of the vaccine versus as a result of having COVID. That's why they tended to have that window, that 28-day period, to then tease out, actually, is this because of the vaccine or is this because of COVID? And that sort of window has stuck, really. And I don't think the JVCI is going to change that. And it seems actually like a very sensible, sort of reasonable window as well of we know you've had COVID, okay, give it a few weeks and then have the vaccine. So then you can tease out, and that's sort of how science works. You can then tease out cause and effect.
Yes, thank you, Michael, and always erring towards the side of safety there again. So yes, effectively not to use the lateral flow test to determine the timing of the vaccine, but more going on the sort of the 28-day period as a minimum, would be the safe way forward. I mean, we have 4 or so minutes left. Unless there are any new themes or questions which are coming in, I'm seeing your head shaking there, Michelle, then I think that any other, I think we actually have answered all the questions, but if there are any other questions that do come in between now and the next few minutes, what we will do is make sure that in addition to the frequently answered questions document, which we'll post on the dedicated Sutton COVID page, we will make sure that we pick up those questions and add those accordingly to the document. It'd be helpful, I think, to share the information of the link to that. I just want to confirm that we are going to be able to do that either at the end of either both in the end of this webinar in the chat, but also to directly contact those who have attended the webinar today. I think I want to thank really everyone who has attended today, particularly first of all the expert panel who have so ably taken all the questions. I think have given extremely comprehensive answers. I hope they've been extremely helpful to each and every one of you, and you're able to feel more confident about children aged 12 to 15 having the vaccine, and also able to promote it to others who have an interest in vaccinating to 12 to 15-year-olds. The more of us we can vaccinate, the better it is for individuals and our communities and families as well. So I want to first of all thank Michael and so thank you, Michael. Yeah, and Sarah, who's just waving, and also Nicola and Una, all of you offering expertise in answering questions. I want to also thank Michelle, who's been helping us with fielding and selecting the questions. And then I want to thank really everyone who has joined this live Teams meet. This has been recorded, so we will be distributing the link for this meeting afterwards as well, and posting that on the dedicated Sutton COVID page. That means you can also watch this again, watch the answers again, and also forward the link to others who may be interested in vaccinating those who are 12 to 15-year-old in Sutton. So thank you all very much for attending. I hope it's been very useful, and I hope you managed to make sure that as many 12 to 15-year-olds can be vaccinated and keep safe going forward. Thank you very much. Good evening.